a higher number of COVID positive cases than others. Maharashtra continues to lead the way. About 25% of the all India cases are coming from Maharashtra. And in Maharashtra now, it's not Mumbai but Pune. Pune now is the city across the country with the highest number of active coronavirus cases. In fact, the number of cases in Pune have been steadily rising. It's crossed every city in the country. And amidst this, the shortage of ventilator beds and ambulances is adding to the woes of citizens. Our top story tonight, as we keep the focus on COVID-19, is on the city of Pune.
A journalist's death in Pune has exposed what's ailing the city's COVID fight. Pandurang Raikar, who was admitted to the newly opened Jumbo COVID Center, could not be moved to a super speciality hospital on time due to non-availability of a cardiac ambulance.
The relatives, they are complaining that their relatives are not being properly treated, no proper medication over here at this Jumbo hospital. So all of the tall claims by the government are falling flat.
The journalist's death has now triggered a big political fight. The NCP is blaming the BJP, which controls the Pune civic body, for the shortcomings at the Jumbo COVID Center that opened on the 23rd of August.
Pune has certainly become the hotspot. We all know that we have beaten in numbers, we have beaten even Delhi. In fact, over the world, globally, India is in the worst situation. And in India, till now, Delhi was in a worse situation, and now Pune has beaten them.
जो भी इसका डिज़ाइन है ये पूरे का पूरा स्टेट गवर्नमेंट का है, ठाकरे सरकार का ये प्रयास है कि जंबो हॉस्पिटल बनाने का। उसमें जो भी टेंडरिंग प्रक्रिया है वो स्टेट गवर्नमेंट की तरफ से की गई है।
Pune, India's auto hub, is now the COVID capital of the country. It has the highest number of active cases among cities at 54,760, which is much more than Delhi, Mumbai, Bengaluru and Chennai.
The patient said that no one has come to examine him since 3 days, and his condition is deteriorating from last 2 days. No one is serving the food, and no the facility available over here at the wheelchair to reach to the bathroom.
We have almost visited 3 to 4 hospitals. None of the hospitals have taken us.
Our main challenge is creating additional beds, creating basic medical infrastructure, and we are moving ahead in a synchronized way. And I'm quite sure that based on our multifaceted strategy, we would be definitely in a position to manage the whole COVID crisis.
The spurt in the number of cases in Pune comes even as Delhi also recorded a jump. The national capital, which saw daily cases dip to less than 700, is now getting over 2,000 cases a day. Experts warn, as the country opens up further, these numbers can only get higher. With Pankaj Khelkar in Pune, Bureau Report, India Today.
So why are the corona cases now once again rising across the major metros, especially in Maharashtra? Joining me now is Dr. Shashank Joshi, member of the COVID task force in Maharashtra. Appreciate your joining us, Dr. Joshi. Maharashtra continues to be the state with the highest number of corona cases. 5 districts have seen a 400% jump in the last 2 weeks. Pune is the city with the highest number of active infections. Why is it that the corona number cases are not decreasing in Maharashtra? Actually, the number of cases in Maharashtra are more than the entire Russia at the moment.
You are very right, Rajdeep, that Maharashtra is a cause of concern, except probably Mumbai, which has again started showing a little bit of rise again. And that's fundamentally because we need to do a dual strategy. One is we need to close the COVID tap through a very stringent public health measures. And I think some of the other, they have not been in perfect place, and which is why we have seen this big spurt. But numbers don't worry me as long as the case fatality rate is low. But numbers of Maharashtra and some of the hotspots like Pune, Nagpur are clearly causes of concern. The second thing which we need to do is early diagnosis and prompt treatment and containing properly. So we need a lot of cooperation from people on distancing, masking, as well as sanitization. Unless and until we get full cooperation from people, destigmatize COVID, and do not close the tap by a very aggressive testing, tracing system, we are still not going to get the numbers down. It is high time that we close the COVID tap through a very hyper-vigilant public health system. At the same time, we do a lot of community sensitization and ensure that we win over people's confidence so that they cooperate in this movement. It has to be a people and public movement together with the administration and the people at large. Currently, that's not happening it right. And I think that's a cause of concern, except maybe some places like Mumbai, where again we are seeing a small spurt coming up. Most of places of Maharashtra are seeing walloping numbers. The only silver lining is better recovery and a lower case fatality rate. But that is no excuse for the higher numbers. We are, of course, also ramped up the testing facilities, and we are doing a lot of RT-PCRs. And also, if antigen testing is done, in negative antigen should get a RT-PCR done. If that is not done, actually, we are having a spreader, super spreader in the community. Also, we need people at the first symptom of COVID not to delay testing. Test early so that we can manage them better, and probably many people will recover very well at home itself if they are, diagnosed early and treated appropriately.
But, Dr. Joshi, while I take your point that the CFR case fatality rate is low, recovery rate is rising, so those are the good signs. The worry is that the infrastructure in places like Pune and some of the smaller districts in Nagpur simply cannot cope up with the rising number of cases. Pune now has the highest number of active cases, more than 50,000. We've seen now reports coming in from the ground that there is a shortage of beds, shortage of ventilators, and that is the big concern, that if these cases continue to spike, will the system be able to handle the increased number of cases?
No, clearly, Rajdeep, you're absolutely right that the system had enough time to gear up and ramp up the facilities. I think they are trying their best to do it, but I still see your point very clearly. But as I said, I reiterate my point, you need to close the tap, Rajdeep. Without closing the tap and without doing a very strong public health system in place of testing, tracing and isolating, we can't keep on filling up our hospitals. There is a limited finite number to which we can fill up. But if the cases from 50,000 go up to 1 lakh, there is no way that we can accommodate these type of cases because the healthcare infrastructure is simply not there. So it is important that at the first symptom, we test and then trace every contact of that human person there and ensure that that traced person is also tested and then treated on time. If we treat early, test early, trace early, we can avoid a lot of these, and you can clearly see then that we can bend the curve. Like many places like Mumbai has done it, Delhi has done it. Now with a little bit of unlocking, you will see a small spurt coming up, but they have been able to mitigate this problem, and Pune needs to do it on a war footing.
I just want to understand from you in conclusion, Dr. Joshi, that, a recent serological survey in Pune revealed that more than 51% of those who tested had shown the presence of antibodies specific to the novel coronavirus. Now, that could mean that an element of immunity could be built in the community. But the worry is some doctors are saying we could be in for a second wave. Do you believe a second wave of infections is what we are seeing with these spurt in cases, or is the spurt in cases only because we are testing more?
So I think that's a very good question. First thing is that sero surveys only indicate exposure and not immunity. So they are very misleading. They only tell us that the virus is exposed. For herd immunity, we need to do prospective testing over a period of time. And we know the corona antibodies decay very fast. If there was some amount of herd immunity in Pune, we would not see these numbers. Secondly, we are definitely testing more. And that is why we are seeing more numbers. Absolute numbers do worry us, but we need to contain them. But they should not be a big cause of alarm. But if the healthcare infrastructure is getting strained, it's a clear cause of alarm. This third question which you asked is it a second peak? I still feel we are in the first peak. So question of the second peak doesn't arise. Maybe in Delhi and Mumbai, we are seeing a small spurt of that first peak which was being mitigated, and a second peak might come. But I still feel Pune is still in the first peak and it's still not been able to, it's struggling. So I think it's time that the public health infrastructure and the administration, they are absolutely on war footing, trying their best to contain it. And we wish them best of luck, and we all hope that they are able to mitigate it just the way Mumbai did, Delhi did, Ahmedabad did, Indore did. Many places in India have done it. I think Pune should be able to do it, but they need to really do it on a very serious note. But also we need a lot of citizen cooperation. Without cooperation of citizens on masking and strict distancing, strict sanitization, we will just lose this COVID tap and we will not be able to contain the tap. If we cannot contain the COVID tap, we are in for trouble.
Those are very, very clear words from you, Dr. Joshi. If we cannot contain the COVID tap, if citizens also don't rise to the occasion, as should the public health infrastructure, we could be in troubled times ahead, especially outside the major metros in other districts. Thanks very much for joining me here on the news today.
Thank you.
And while corona positive cases are rising all the time across the country, so are the recovery rates. Many people have recovered from COVID-19. We have a COVID survivor with us today. Kiran Mazumdar Shaw, the chairperson of Biocon, joins us. And welcome back in a way, Ms. Shaw. Fully recovered. What's it been like?
Well, first and foremost, Rajdeep, I don't want to call myself a corona survivor because I just want to let people know that it need not be a life-threatening disease at all. I shared my COVID story for many reasons. One was I wanted to remove the stigma from, declaring that one has caught the infection and one has tested positive. And the other one was because of the kind of mild disease that I went through, I wanted to share my experience and so that people don't get alarmed about contracting COVID. And I also wanted to share some of the lessons I've learned from COVID, which I thought could be useful in managing the disease. So that's why I basically wrote that diary and that blog.
It's a very interesting diary and a blog you've written. I just want to what's the biggest lesson? Let's turn to that. Since you're saying that you wanted to share the lessons that you've learned as someone who's not a corona survivor, as much as someone who had corona and has fully recovered, what's the biggest lesson?
Who has battled corona. Yeah. So I think one of the lessons that I learned during the corona, fight that I had was the fact that one must test as soon as you perceive some symptoms. Doesn't mind how mild they are. But the early testing actually allows you to be treated early and you will actually go through a mild experience is what my belief is. And I have actually over the last 2 weeks, Rajdeep, as you can imagine, ever since I sort of put it out on Twitter that I was positive, of course, lots of people whom I know reached out to me saying, oh, we've tested positive, what should we do? And in each of these cases, I've been able to guide them and counsel them, and all of them have basically come out of this just like I have. Many of them have gone through a slightly worse kind of an experience than I have. But I now know that people who have tested early actually have come out very easily. And people who are in denial and who kind of delayed the testing have actually had more severe symptoms. So that is the first lesson I learned. And I want everyone to know that early testing actually ensures in most cases that you will have mild disease. And the more you are in denial and the more you delay your testing,
one of the...
you may, get a severe...
One of the interesting aspects of your blog, ma'am, is what you have told us, which many of us didn't know, is that you asked for a CT, a cycle threshold value, to assess your viral load. And you say, when I saw it was 23, I felt the load was safe enough for me to be home quarantined under tele-supervision. Please explain to our viewers, to us, what is this CT value test that you did to test your viral load and where do you get it done?
First and foremost, Rajdeep, I don't think anyone realizes, but any time you do a RT-PCR test, there has to be a CT value. The cycle threshold value simply means how many cycles of amplification did it take for your result to come positive. So lower the number, higher is the viral load. Normally, it is accepted that below 20, if the positive reading comes below 20, you have a high viral load. And in my case, I had a moderate viral load of 23. And I felt that since my symptoms were not severe, I felt like home quarantine. But the most important thing I did was to measure my inflammatory markers, because inflammatory markers are very important in COVID to measure. So the moment I saw that my inflammatory markers were also low, my CT values were moderate, and my symptoms were mild, I felt I was safe enough to quarantine at home. But what I do believe is that if you have a highly...
Are you saying, ma'am, that everyone who does an RT-PCR test should also do this CT value
It's
test?
not
And when
also
you get it done, is it freely available?
Look, Rajdeep, when you do an RT-PCR test, you have to declare the CT number. People don't realize this. An RT-PCR number is not just positive or negative. It also comes with a CT number, which nobody looks at. Now, of course, there are lots of... We will not confuse the CT number by saying it indicates severity of the disease. No, that it does not. Okay? But what the CT number does tell you is what is your viral load. And at least there may be many debates about the low viral load numbers, but if you look at any CT number that is below 20, it obviously indicates a high viral load. Now, that high viral load is one of the risk assessment factors, saying that if you have a high viral load, there are two things. One is, if it's a young person who is asymptomatic, obviously this person with a high viral load is a potential spreader of the disease, right? A super spreader. If you are an older person, say above the age of 50, if you have comorbidities, and if your symptoms are pretty, noticeable, like high temperature or cough, then your risk factor actually increases, which means that if you have high risk factors, it's better for you to be supervised in the hospital rather than home care. That's the way you have to look at the CT number.
So what you are telling me is that if you are below, let's say 23 or certainly below 20, then you should admit yourself to a hospital. If you are above
Not
23 in your CT load factor, then...
No. Rajdeep, please hear me again.
Not necessary.
Not necessarily. If you have no comorbidities, if you're young and you have a high viral load, you don't need to go into a hospital. You can self-quarantine, home quarantine, but strictly adhere to it because you're a super spreader of the infection, right? So especially if you have people at home, you should be careful because they can easily catch the virus because you have a huge viral load, right? But you can home quarantine if you do that safely. But if you have got high viral load, you are over the age of 50, you have diabetes or cancer or heart disease, then I think it's better for you to be in the hospital. Because in a hospital, if the high viral load does not get contained fast by your body's own immune response, you can start getting into a hyperimmune response, which is about inflammation. Then it creates hypoxia and all the complications that happen with COVID.
Let me turn to your daily dose of medicines that you took. You said you were put on a course of favipiravir, azithromycin and paracetamol. Apart from this, you say you continued with your daily dose of vitamin C, vitamin D, zinc, baby aspirin and Chyawanprash, not to mention twice a week 200 mg dose of HCQ.
Yes.
And these were mild symptoms.
Yeah, but the other medicine...
I presume that if you had... So you have a very different treatment for mild symptoms than you would have had your symptoms got severe.
Yeah. So generally what happens is when people go to the hospital with little bit worse symptoms than what I have described, I think they have immediately, most of the patients have been put on a combination of remdesivir and dexamethasone. And that itself sorts out people if they come early with a little, more symptoms than what I have described, right? Like, for instance, if they've had high viral load, if they have high fever, they have a cough, those are the kind of things. And then they're also got comorbidities or they're slightly over the age of 50. Then all these then come into effect and you have to take a chest CT. If you have seen any pneumonia patches, then this is what they normally do. And the good news is that in a hospital, you can be managed very well. And most of these people within 5 days can go home and continue with just a simple supportive care at home, where they don't need all these hospital interventions.
You've gone through great detail in the lessons that you've learned, apart from, of course, saying don't panic on testing positive. You've also suggested that you need to monitor your oxygen saturation several times a day to ensure it doesn't drop below 95%. Obviously, what you're saying, while don't panic, but also don't get complacent. Am I correct?
Yes, absolutely, Rajdeep. Because this is a disease that we are learning so much about every day, right? So as you learn from the disease, like many people who have said they didn't have breathing difficulty, but they suddenly realized that their oxygen saturation level had dropped. So that was a worry. So that is why you are requested to keep monitoring your oxygen saturation levels, because you don't even realize when it drops. And the other thing is, you should sort of measure it after a little bit of a brisk walk or some exercise to make sure that it's not suddenly dropping, because that all indicates that there is some hypoxia setting in, which is not good.
But you obviously had the benefit, let's say, of telemedicine, of being in constant touch with the doctors. What does an average citizen do? I mean, if you home quarantine yourself, how do you ensure that you are getting the right medical supervision, treatment, guidance? Is a question a number of people have been asking. So as someone who's gone through it, you were obviously privileged enough to go through telemedicine. Many others may not have that opportunity.
No, I think there are a number of hospitals that actually are offering telehealth support, okay? And it is for patients to reach out to the hospital chains and say, look, I'd like to be supervised. There are doctors who are very willing to do that. I know that my own doctors whom I mentioned in my blog are telling me that they're being inundated with requests to see whether they can help. So they can't help everybody, but they're getting their other colleagues involved in helping these patients. So there are a number of these kind of telehealth helplines available. In fact, there are many companies now who are just focusing on telehealth support for COVID patients who are home quarantined.
I must ask you in conclusion, you seem to have sort of got yourself through a fitness regime also, short walk, yoga, a diet of fruit, vegetables, lentils, cereals. So you've really made an effort to ensure a sort of 360-degree approach to combating or battling COVID.
Well, Rajdeep, I must confess I was doing all this before COVID, okay, and before I tested positive for COVID. So it's helped in a way.
Okay.
What I was trying to say was that you must continue with that during COVID. And in fact, if you have COVID, it should in fact become something you should adopt, because I really think it's about health and fitness. And it is about keeping fit and trying to basically keep your lungs active, and lungs, strong. So in fact, I heard one of these kind of experiences by a famous singer who said that he kept singing to make sure that his lungs kept being strong. So I think you should find your own fitness level and do whatever it can. A lot of people are very familiar with yoga's breathing exercises. So I think you should use whatever suits you to try and keep fit. Even just using the spirometer.
I must tell you, I've been doing a 45 minutes walk
Good.
I've been doing a 45 minutes walk in Corona times, and I think I've got a little bit fitter than I was pre-Corona. But my final question, ma'am, and this one troubles me. You say my constant companions were Netflix and Amazon Prime. Avoid TV and social media as negative news is bad for fighting COVID-19.
Well, you know,
How are you
Rajdeep,
tracking the news?
well, I only used to listen to just the headline news and then move on. Because I really feel that, you know, a lot of our
Fair
programs
enough.
keep on listening to, go on focusing on the negative news. So that's why I get a bit frustrated. You know, at this time, you need feel-good factors. You need good news. You need good stories. But I find very few of them on social media and on TV channels.
Well, I want to tell you, Ms. Shaw, every night before I end my show, I give you a good news story. And also those who are watching you today will see you today as a feel-good symbol, as someone who has overcome all the paranoias that you might have had about COVID-19, and you're smiling and cheerful. So this is good news that you're back on your feet, and many more like you are also recovering. You don't need to be frightened of COVID, and you don't need to stigmatize someone who's got COVID-19. Thanks so much, Kiran Mazumdar Shaw, for joining me and sharing your thoughts.
Thank you, Rajdeep.
So there we've had Kiran Mazumdar Shaw sharing her COVID-19 tips. Let's turn from there to the other big story, because India and China remain in a face-to-face combat situation that could spiral out of control. Today, the army chief is in the eastern Ladakh area, where he took cognizance of the preparedness on the ground. Even as military talks between the two countries continue to hit a dead end, there is the battle that is continuing for strategic control of key areas in the eastern Ladakh Valley. Our correspondent Abhishek Bhalla is on the ground with this report.
The southern banks of the Pangong Lake, now dominated by Indian positions, with Chinese positions in India's line of sight and fully vulnerable to Indian action. But like we also told you first, the Indian Army's actions in the last 6 days in Ladakh aren't restricted to just the south bank of the Pangong. In fact, the Indian Army has moved to take dominant positions along the entire stretch in eastern Ladakh. Apart from the dominant positions on the Pangong south bank, the Indian Army has readjusted its positions across the lake on the north bank's Fingers complex, further north in Hot Springs, and even at the restive Daulat Beg Oldie sector of northern Ladakh that overlooks the Depsang Plains, a sector where China has provoked continuously with a build-up and blockade of Indian patrol teams. Even south of the Pangong south bank, the Indian Army has strengthened its positions in Chumar all the way south to the Demchok sector. But what do these actions actually mean on the ground? To begin with, the Indian Army positions at these strategic heights means it becomes more difficult for China to mount any more aggressive actions. The Indian posts can track Chinese movements far more easily and in real time, with early warning of Chinese build-up and activities. India's dominant positions also allow better forward planning of India's next steps.
The situation in eastern Ladakh remains extremely tense in the backdrop of certain actions taken by the Indian Army to secure territory and provide a tactical ultimatum to the Chinese. While a fragile line of communication still exists between the brigade commanders of the two armies, it's very clear that from here onwards, temperatures are going to rise despite the onset of winter in eastern Ladakh.
With the army chief taking stock of the actions of his troops, India's men on the ground also know they have the full support and backing of the leadership to do what it takes. With Abhishek Bhalla in Leh, Ladakh, Shiv Arur in Delhi for India Today.